Provincial Health Office, Misamis Oriental. With 32 DOH programs being implemented and overseen by the Provincial Health Office, Misamis Oriental, in spite of the challenges from the influx of COVID-19 cases in the last 2 years, these are the office's activity highlights from January to June 2022. COVID-19 response. With the continuing initiative to conduct COVID-19 immunization rollouts at the provincial capital grounds, the Provincial Health Office, with the assistance of the Provincial Disaster Risk Reduction Management Office, MIS-OR Cares, Assistant Provincial Administrator's Office, and other departments, the office has inoculated the following number of people since January 2022. First dose, 174 vaccinees, including 26 persons deprived of liberty from the Misamis Oriental Provincial Jail, 129 vaccinees, including 8 PDLs. First booster, 5,075 vaccinees, including 267 PDLs. Second booster, 300 vaccinees. The target given by the Department of Health is 80% of the total eligible population of the province, which is 795,186 out of 985,727 individuals. Based on the data, dated July 2, 2022, the coverage for the entire province of Misamis Oriental, those aged 12 years and up, are as follows. First dose, 664,629 vaccinees, or 83.58%. Second dose, 600,084 vaccinees, or 75.46%. First booster, 75,087 vaccinees, and second booster, 2,860 vaccinees. For kids aged 5 to 11 years old, coverage for first dose is 50,580 vaccinees, or 38.12%. Second dose is 29,996 vaccine recipients, or 23.13%. With another ongoing initiative, swabbing for RT-PCR testing is continuously done once or twice a week, with specimens submitted to the Department of Health for processing. Just this year, 481 swab tests have already been performed. In response to a tragic mass vehicular accident in Balingasag that claimed 13 lives last January 12, 2022, a psychosocial intervention or post-trauma counseling in Barangay Apos Kahoy, Claveria was performed in February 8 to assist and ensure the emotional well-being of the 49 participants that included kids as young as 3 years old. The Field Health Services Information Systems is an official system that produces the Department of Health's annual report for supporting decision-making in the healthcare system. To ensure the quality and accuracy of the report, the collecting process requires the improvement on the indicators as well as the analyzation and collaboration, hence a quarterly validation of FHSIS data with the Provincial DOH Office in Reach Health. The first among 4 was done from May 4 to 6. To date, there are 12 teen centers in the province that have been accredited by the Department of Health as adolescent-friendly health facilities, or AFHF. Last May 26 to 27, the Provincial Health Office conducted the ADEPT training, or Adolescent Health Education and Practical Training, as well as establishing and making their institutions functional as adolescent-friendly health facilities, attended by 1 representative per LGU. To ensure and maintain high accuracy, reliability, and efficiency of laboratory services, on-site facility visits of laboratory microscopy centers were done to conduct Quality Assurance System, or QAS, last March 23 in RHU Medina and MIS-OR PH Talisayan, specifically for National TB Control Program, Monitoring and Supervision, and Malaria Control and Elimination Program, MCEP, Outreach Training and Supportive Supervision. Facility visits were made to the following rapid diagnostic test laboratories, or RDTLs, to augment the laboratory and detection capabilities of the province, including orientation of the entrained medical technologists in the operation of the expert MTB-RIF or GenX machine. Annual Operational Plan and Local Investment Plan for Health Orientation from May 17 through 20. An orientation was done, participated by rural health units, city health offices, hospitals, geographically isolated disadvantaged areas, indigenous people, and PGMO representatives from the budget, accounting and planning offices on the strategic process of budgeting to include gaps and analyses in the planning process for a more comprehensive and inclusive annual operational plan and local investment plans for health based on mandates from the Universal Healthcare Law. The Mental Health Playbook, or Peer Support Group for the Youth, is one among 7 playbooks that contain implementation guidelines that provide local government units with ready-to-use tools to help promote and protect a critical determinant of health and well-being. The implementation of these playbooks is part of the requirements being an advanced implementation site for the universal healthcare. While the Provincial Oversight Committee began training in October 2021, earlier this year, however, the training seminar on Peer Support Group for the Youth for Peer Facilitators was completed to enable 31 individuals from the 3 pilot sites in the province, namely the municipalities of Tagoloan, Claveria, and Villanueva, to build resilience for themselves and to others in sustaining the mental health playbook. The local government unit scorecard validation was finished in May of this year. The LGU scorecard validation is done annually and centers on the conduct of data validation surveys to be conducted among the interlocal health zones for the purpose of learning from weaknesses and gaps that are identified, and serves as evaluation of different LGUs on compliance to the mandates of the Magna Carta for Healthcare Workers and the UHC law. Barangay Health Workers Convention and Universal Healthcare Orientation. In June 2022, 3,300 barangay health workers were convened in their respective interlocal health zones to attend the BHW Annual Convention and Universal Healthcare Orientation, at the same time receiving their honorarium of 3,000 pesos per BHW.